Hi, everyone. Welcome and thank you for joining us. My name is Dominique LaRochelle, and I work as a Senior Gender Equality Specialist at Global Affairs Canada.
Hello, welcome everyone. My name is Maria Carrasco, and I work as a public health and public policy consultant.
Hi, everyone. My name is Francelle Kwankam Toedtli, and I'm a sexual and reproductive health and rights and maternal health expert working as an independent consultant.
We're really happy to have the opportunity to present the leadership project that we've been working on together on the future of global sexual and reproductive health and rights, or global SRHR. As you know, the field of global SRHR is going through many changes right now, including funding cuts and policy shifts. In our leadership project, we're exploring how SRHR leaders see these changes and how progress can continue, especially in low and middle income countries. To explore this important topic, we're speaking with about 20 to 25 inspiring SRHR leaders from different regions and organizations, and we will be summarizing key findings from the interviews in a journal article and a policy paper. The study is still ongoing, but we're really excited to share initial insights and policy ideas that have emerged from our work so far. Let's dive right in. So let's start by looking at some of the key shifts that are shaping the global SRHR landscape today. As many of you are experiencing, we see major donors pulling back funding, creating gaps in essential services. At the same time, there's a growing backlash against SRHR and gender equality, often driven by very well-funded anti-rights actors. We're also seeing geopolitical shifts, with some previously supportive governments being less engaged now, and with multilateral coordination in flux, making collective action more and more challenging. We're also seeing new actors entering the field, often bringing fresh ideas and innovative approaches. However, their contributions have not yet fully replaced core fundings, leaving organizations and governments under significant resource pressure. And as we know, funding cuts are hitting marginalized communities the hardest. With that context in mind, I'll now hand it over to my colleague Maria, who'll share what we've been hearing from SRHR leaders so far, and who'll walk us through some of the key emerging results and trends that we're seeing from our interviews. Over to you, Maria.
From the interviews that we have conducted so far, it is clear that the ground is changing, the ecosystem is changing, but the priorities for sexual and reproductive health and rights have not changed. If anything, they have expanded. One thing that does need to change, according to some of our participants, is the need to ensure enhanced communication and using language that is accessible to people and meeting people where they are. So some of the priorities for areas where SRHR can connect with are maternal and newborn health. Everybody loves to see healthy moms and babies. Also economic productivity and talking about return on investment, security and stability, climate resilience, and mental health. The leaders with whom we spoke talked about the importance of using softer labels. So instead of talking about comprehensive sexuality education, for example, they are now talking about life plans. Instead of gender equity, they are talking now about equality of opportunity. So the content remains the same, but the labels change to meet the times and the moment. This theme of meeting people where they are was also extended to the importance of engaging faith actors around shared goals, such as reducing maternal mortality, and also recognizing Generation Z as a powerful advocate to drive accountability. At the same time, several of the participants noted the importance of knowing where the red lines were. And these red lines were on understanding that key principles needed to remain while language and tactics could change. Another area that was very important was changes in governance and operations. So in this area, the participants emphasize the very important need of power shifting and power sharing. So this means shifting agenda setting to local actors and also redistributing financial power. It also means building national research and data capacities, and finally, centering local knowledge from midwives, community health workers, and feminist movements, understanding their knowledge as very important knowledge to advance SRHR work. Another area of emphasis was the role of multilateral organizations and development banks. For development banks, they are emerging as a powerful ally that can help to keep governments accountable. And for multilateral organizations such as the World Health Organization and UNFPA, participants noted the need that for them to continue providing a neutral role, providing guidelines and also technical assistance and evidence, ensuring that the work is based on evidence, and also a critical role sustaining the rights language and the importance of rights in SRHR work. Finally, participants spoke about the importance of local feminist and community leadership to sustain hope and the work of SRHR. These organizations in the past have been the ones that are ensuring that the work remains on the ground, and this is exactly what they should be, they are doing and they should be doing at the moment, and they need support.
As the project proceeds, we plan to complete the remaining interviews, ensuring that we get a well-rounded number of interviews across candidates from diverse backgrounds and organizations, and finalize the data collection and analysis. Once we finish the analysis, we're aiming to develop a thought leadership article that explores some of the key concepts we've uncovered and why they're so critical to SRHR and global health leaders in this important moment. The second key deliverable in the leadership project is a policy brief that will outline key actionable recommendations for decision makers across implementing agencies, multilateral agencies, and donors. We'd like to close by reflecting on what this leadership journey has meant for us as a team and throughout this project. At a time of real disruption in global SRHR, we've tried to lead authentically by contributing and collaborating honestly, communicating challenges along the way to each other, and by acknowledging uncertainty rather than pretending it doesn't exist. We practiced inclusive leadership by listening deeply to leaders across regions, institutions, and roles, especially those navigating constraints on the ground. We approach this work strategically, gathering insights not just to describe the moment, but to help inform how the field can adapt and move forward. And we aim to be impactful by committing to translating this work into articles, into policy-relevant insights, into conversations that can support decision-making during this period of realignment. This project also represents our personal growth. Together, we stepped outside our comfort zones by self-starting a scientific and leadership project, and by shifting from primarily technical or policy roles into leadership that requires holding complexity, uncertainty, and unresolved tensions. We've learned how important it is to help shape narrative, not to oversimplify reality, but to make it navigable. Finally, in terms of sustaining momentum, we're committed to carrying this work forward through publication, continuing engagement with leaders in the field, and by applying these lessons to how we lead and support the shaping of global SRHR going forward. This journey gave us the energy, the tools, and the collective support to continue growing as leaders and to contribute meaningfully in one of the most critical moments for global health, and we are grateful. Thank you all so much for your time and energy, and we look forward to continuing this dialogue.